Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome. Today's presentation, Treating Neck and Back Pain from Home, is presented by Dr. Michael Goldin. Dr. Goldin is a physiatrist with the Washington Township Medical Foundation. Dr. Goldin earned his medical degree from the Virginia Commonwealth University. Without further ado, please welcome Dr. Michael Goldin.
Thank you, Lucy, and thank you all for joining me today. The goal of today's presentation is to teach you ways to manage back pain and neck pain from home. My goal is to show you simple ways to try to manage your pain without needing more invasive treatments. Back and neck pain have many possible causes. Some causes are concerning, but much more commonly, the causes are due to mechanical wear and tear and more stress across the structure than it's able to tolerate. Now, I hear common questions from people. One of the main questions is, what's the problem so I can fix it? Oftentimes, I try to explain, I recommend looking at this as a problem to be managed as opposed to fix and never think about it again. It's often a combination of some level of degeneration of a structure as well as more force across the structure than that structure is able to tolerate. I often hear people say, what's the best treatment? If there was a best treatment, I would give it to everybody. However, no treatment is 100%, and many treatments involve risk. For that reason, I typically recommend starting with the least invasive treatments first. Today, I'm going to go over the treatments of exercise and appropriate biomechanics. Basically, I want to have you learn good exercises, learn how to do biomechanics and treat your spine well, and avoid treating your spine poorly. For back pain, there are three main exercises that I like to review with you. They target the stomach muscles, the back muscles, and the buttock muscles. I'm also going to show you some progressions. If it hurts a little bit or it's too hard, we'll make it easier. And if it seems too easy, I'll show you ways to make it a little bit harder. So, for the first exercise, you can lie down on a yoga mat, and I want you to keep one knee bent, the other leg straight, and both arms up over your head. Bending one knee lessens stress on the spine. Now, to perform this exercise, use the straight leg and both arms and lift up. And then hold this for 5 seconds. 1, 2, 3, 4, 5. And slowly lower. And again. 1, 2, 3, 4, 5, and slowly lower. If this hurts too much, the easier progression is to move arms down by your side and go up again just with the leg. 1, 2, 3, 4, 5. And again. 1, 2, 3, 4, 5. If neither of these are difficult enough, then you can use weights in your hand. Most important with the weights is don't put them above your head because I don't want you to get hurt. But you can go up at an angle. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So I typically recommend starting with 5 to 10 repetitions on each side. I did it just with one leg bent. You would bend the other knee and do the other side as well. I recommend doing it 3 to 4 days a week. Every week you increase by 1 repetition. In 6 months, you're doing 30 repetitions on each side. For the next exercise, I recommend using 2 yoga blocks. You rest your calf on the yoga blocks and bend the other knee. Now, this exercise is to target the low back muscles. And so to perform this exercise, use the left leg, the leg resting on the yoga blocks, and lift up and hold it. 1, 2, 3, 4, 5, and down. And again. 1, 2, 3, 4, 5, and down. You should feel the low back muscles working. If this is too hard or this is painful, I recommend barely lifting your pelvis up, just enough to feel the low back muscles working, but before you feel any sort of low back pain. So for example, if that first one was too hard, I'm lifting up much less right now, but I can still feel the low back muscles working and my pelvis is actually still touching the yoga mat. 4, 5, and down. And again, 1, 2, 3, 4, 5, and down. And if this is too easy, I recommend moving the yoga blocks out and putting your foot on them instead of your calf and holding up. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now for the third exercise, I'm going to bring the yoga blocks back. And I start in the same position. Instead of using the left leg to lift up though, I'm going to use the right leg with the knee bent. And by using this leg and the angles, it targets the buttock muscle more. So to perform this exercise, I'm going to use the right leg and lift my pelvis up. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. If that's too hard or if that's painful, the same thing applies where you go through only pain-free range of motion. So you can try barely lifting up your pelvis to make it easier, like this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And if both of these are too easy and you want to make it harder, you can move the yoga blocks to the side and bring your other leg up. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So these are the 3 main exercises that I recommend. As with the first 2, I recommend starting 5 to 10 repetitions on each side, 3 to 4 days a week. Every week you increase by 1 repetition. In 6 months you're doing 30 repetitions on each side. The next couple exercises that I want to show are to strengthen the chest muscles and the shoulder blade muscles. And so the first one I'm going to do is up against the wall. It's a wall push-up. And when I do this, I'm going to position myself so my hands are up against the wall And my fingertip is at about the height of my shoulder and at about the width of my shoulder. I also make sure that my front leg is on its tiptoes. That helps spot me to make sure that I don't sag my low back, but it also makes sure that I don't use my leg to do the movement, and instead I'm focusing on my arms doing the movement. And so to perform this exercise, slowly lower yourself down. And the key is to go as far as comfortable and come back up. And as I do it, my elbows stay in nice and tight. And same thing, we do it on both sides. I'll do it the other side here. The key really is making sure, as much as anything with your hands, that your toe is face down in the front foot to make sure you don't use your foot to do this movement, you actually use your hands. And as I move to the side, I'm going to reposition my hands. Fingertips at the level of my shoulder and also at the width of my shoulder. If this is too hard, you can move closer to the wall. And if it seems too easy, you can move farther backwards. It is very easy to break form with this and have your elbows move outward. The goal really is to focus on making sure your elbows stay in nice and tight. And if it hurts, if you go through range of motion, the key is to make sure you go back and only do it through pain-free range of motion. Now for the second exercise, we just did a push movement. Now we're going to do a pull movement. And to do this, we get back on the yoga mat, and I'm going to take my hand, put it on my belly, and my other hand is straight down by my side. And so to perform this exercise, I use my right hand and right elbow and push down into the yoga mat. You don't see a lot of movement, but when you do this at home, you'll feel the shoulder blade muscles activating. 3, 4, 5, and down. And again. 1, 2, 3, 4, 5, and down. I don't have an easier progression for this exercise. If this causes pain, I do recommend you seek medical care. If this seems a little bit too easy, I recommend using one of the yoga blocks. And by putting that under your hand, it allows you to lift yourself up a little more and make it a more challenging repetition. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So those are the 5 exercises that I recommend. I try to make it very manageable for you so that these exercises can be completed in a reasonable amount of time. Now, most people are not exercising for a living, which means the majority of time is spent not exercising. And I want to make sure that we also review biomechanics, and this is what to do when you're not exercising. We're going to go over low back biomechanics first. After that, I'd like to go over biomechanics for the neck. For the low back, most people know that we should not bend forward like this. However, when I see people doing various activities, this is how they do those activities. You can see that there's significant bending of the spine, and over time and over a lifetime, this will cause stress. Oftentimes, if I ask somebody, how should you get down to pick something up or to do something on the ground, they say, I know I should squat. Well, if you squat with correct form and your feet are about shoulder width apart and you squat down, you can see my low back and spine is still leaning forward. And over time, this still causes stress. In addition, this can put stress and pain on the hip and on the knee joint. It's for that reason that I propose a different way to get down, and I tell this to many of my patients. I recommend kneeling down. So as I kneel down now, you'll see my spine stays much more upright. As I do this, I stay up, and I'm also activating the important buttock muscle, which over time will give functional gains. As you do this, when you're down, it's much easier to grab something, to vacuum, to sweep, to clean up, and you won't have that repetitive overuse on the spine that prompts you to see a doctor like me. Now, some activities don't require kneeling all the way down. And for that, I recommend a different biomechanical maneuver. I call it a split stance, and I had a patient explain to me that's warrior pose. So I'm now going to call it warrior pose, where you put one foot slightly in front of the other, you tilt a little bit, and you bend the forward knee. As you do that, you stay more upright. And by doing this, it also engages important functional muscles, and it reduces how often the spine bends forward, which over time adds stress. This is something I typically recommend for things you do, say, at a sink. So I have patients come in and say, it hurts when I wash dishes. How do you wash dishes? Well, most people bend forward like this. I want to try to change behavior a little bit. And if you instead do this over time, I think it is very possible you will tolerate these chores. You might not like them, but you're able to do them, hopefully, with less pain. Those are the biomechanical recommendations that I make for the low back. For the neck, it's a little trickier, and the thing that I like to focus on today is screen time and screen usage. The ideal position for a screen is with the top of the screen at your eye level. The main screens that I see people use are phones, sometimes tablets, laptops, and desktops. It is very rare that I see somebody with a smartphone holding it like this. I don't think I'm going to get people to start holding their smartphone like that. For this reason, I typically recommend trying to use your smartphone as minimally as possible, and I am well aware this is much easier said than done. When it comes to laptop usage, my best recommendation is to split up the laptop monitor and then also use a separate keyboard. This will allow you to have the laptop monitor up at eye height and have the keyboard down at a more appropriate ergonomic height. With respect to desktop computers, you might find you still should elevate your monitor a little bit. And it might feel awkward at first, but that doesn't mean it's wrong. Your neck will likely get used to this, and over time you will reduce the stress of the neck doing similar things that we just described with the low back, bending forward like this. So in a good presentation, you say what you're going to do, then you say what you're saying, and then afterwards you say what you just said. We talked about good exercises. Strengthen the stomach muscles, the low back muscles, the buttock muscles, the chest muscles, and the shoulder blade muscles. We also talked about good biomechanics. If you need to get low, you kneel down. If you need to get less low, you can do warrior pose or split stance, and screens should be up at eye level. The last thing that I want to mention is kneeling can be hard on the knees. And I've had patients tell me this. It's for that reason I recommend people use knee pads. It might be tough to see that I'm wearing knee pads under my sweats, but by wearing those knee pads, I can now get down, even off the yoga mat, and I don't have stress on my knee because I'm not thinking about kneeling down, I'm just doing it. Again, over time, every time you kneel down and you don't bend over, it's less stress on the spine, hopefully to help you avoid having to see me in a professional capacity. Thank you. Any questions?
Thank you, Dr. Goldin. How often should I continue these exercises once I achieve pain relief?
Thank you for asking, Lucy. That's an excellent question. I recommend doing these exercises for the rest of your life because they only work if you do them. I know that's not the answer that you want to hear, but I frequently give it because it is as truthful as I can be.
Can neck pain or soreness be tied to shoulder problems, such as a shoulder impingement?
Oftentimes, neck pain and shoulder problems happen together. One can cause the other, but I often see people with constellations of symptoms. And very commonly, people with neck pain also have shoulder pain because similar structures get stressed with bad biomechanics in both the neck and the shoulder.
I am taking pain medication for back pain. Should I stop taking the medication while exploring exercises as a treatment option?
That is an excellent question. Unfortunately, I think that is beyond the scope of what I'm able to manage with this type of modality. I think that it is always important to speak to your prescribing physician before you make any changes with the medication.
Doctor, I have to be honest. I know myself, and I won't commit to a 3 to 4 days a week of exercise. Are there other alternative therapies that I can explore, like maybe yoga once a week?
There is some evidence that yoga can help manage chronic low back pain. So one of the things that I do commonly recommend is pick something and do that thing that you will keep up with. And in addition to that, if I had to pick exercises or good biomechanics as the most important thing, I think good biomechanics are probably more important than the exercises.
Okay, our last question. At what point should I see a therapist or a specialist if the pain does not go away?
The general rule of thumb that I explain to people is that most wear and tear problems go away after a month. That's not a blanket statement. That's not absolute. So it's a combination of waiting at least a few weeks and also listening to yourself and what you're comfortable with. If you want to see somebody sooner, you will never be faulted for going in to see somebody soon to have a professional evaluation to treat your back or neck pain.
Thank you. This concludes our program. Thank you, Dr. Goldin, for your expertise, and thank you to our viewers for tuning in. The entire broadcast of today's event will be available on YouTube and Facebook.